Hi again. Don't hate me. Today I will be talking about something that may not be the most appealing of topics, so bear with me. Leprosy isn't exactly the prettiest thing to look at. I agree. But before I start talking about it, I would like everybody to keep in mind that there are many people around the world who have it. So we should refrain from making disgusted remarks about it. It's kind of like getting a cold. The person who has it probably had no say in whether or not they got it, or what they look like when they get it. Therefore, I will not be displaying any explicitly graphic pictures. You're welcome. Cool? Cool. Now, question 1. What is leprosy? Leprosy is a chronic infection, also known as Hansen's disease. Medical speak confuses me too, so I'm going to try to make this as painless as possible. Leprosy is caused by a bacteria known as Microbacterium larvae. Yeah, it'll work. It's basically a virus, which means it cannot survive on its own. So it uses other healthy cells to survive and spreads through the entire body. Question number 2. How can I tell if I have it? One of the simplest answers to this question is skin lesions. These lesions are lighter than your normal skin color and have a decreased sensation to pain and heat and touch. These lesions might look something like this. Like I said, these aren't too graphic. So if you don't want to see, don't look. Back to it. Other symptoms might include muscle weakness, numbness in the extremities such as hands, arms, feet, legs. If you are seeing or feeling any of these things, chances are you've had the disease for a while, since the bacteria that causes it has a long incubation period, which means it takes a long time for these symptoms to appear. Question number 3. How does the doctor find out if it's leprosy? They usually do what is called a skin biopsy. They surgically remove a section of your skin. Ow. Depending on how severe it is, they may remove a small section of the lesion. Ow. Or the entire thing. Ouch! They then take what they removed and perform a series of tests on it. Fun fact! Leprosy is acid-fast. This means that if the doctor or the lab uses an acid-based dye on the specimen, it won't stick. It's dye-resistant. Kinda gross, but I thought it was kind of neat after I interpreted all of the science mumbo-jumbo. So because the bacteria can't grow on its own, you can't multiply your sample in the lab. That's why they usually take a big chunk out of you. Ugh. Question 4. Who gets leprosy? Sorry about the sweatshirt. I got cold. Who gets leprosy? This covers a lot of areas. For starters, leprosy is contagious, but not in the way you are thinking. Skin-to-skin contact will not give you leprosy. What will is if you have close, repeated contact with mouth or nose droplets from the person. In other words, it's more of a saliva thing than a skin thing. It's also been found that if you have a certain genetic makeup, you are more susceptible to contracting leprosy. That sucks. Don't freak out! I looked it up, and obviously the genotype is very specific, and only about 5% of the world are genetically susceptible to leprosy. Here in America, a good deal of us have the option to go to the doctor if we so much as blink funny. Hey, leprosy is treatable! To treat leprosy, doctors usually prescribe 2 or 3 hardcore antibiotics that I cannot pronounce the names of, so I'm not going to try. The person takes these antibiotics anywhere from 6 months to a year. Yay again! After about the first month of treatment, 95% of people who have leprosy are not contagious anymore. Unfortunately, too many people do not have the option of consistent medical care, so they do not get these wonderful antibiotics to cure themselves. Question number 6. Do their arms and legs fall off? It is a common misconception that people with leprosy will eventually lose their limbs. Como se dice? No, you do not lose your limbs because of leprosy. However, there is a significant amount of disfigurement, dysfunction, and disablement that comes with untreated leprosy. Because of the loss of tissue, fingers and toes become disfigured over time. Cartilage is constantly absorbed into the body, causing large lumps and bumps to appear. As I said before, it is a deplorable and completely inopportune infection to be burdened with, and deserves a great deal of attention, especially in places like India, Brazil, Madagascar, Mozambique, Tanzania, and Nepal. These places were recorded as having 90% of leprosy cases in 2002. I know that was a long time ago, but it's fairly recent, if you think about it. 90%. That's devastating. And even though these people are a little frightening, it's important to remember that they're still people, and should be treated as such. I don't know the answer to a quick start cure-all, but I'm sure there are plenty of aspiring doctors out there who have plenty of ideas. So, to those of you, keep studying, please. So be careful. Wash your hands. See you next time.